Dr. Marty Kotlar.
Hello, everyone. Thank you, Dr. Siegel. I want to thank everybody at Discount Medical Supplies for inviting me to do these presentations. I enjoy doing them, and I hope everybody enjoys listening to them. So we're going to switch slides now. You should see the slides changing across your screen. Today's topic is billing and coding for lumbar braces and home use cervical traction devices. A little bit about myself before we get started. I'm a chiropractor. I practiced for 16 years before I started Target Coding. I'm the president and founder of Target Coding. I started Target Coding about 9 years ago, and I am certified in CPT coding and certified in healthcare compliance. Those are what those letters are after my name, if you were curious. I write articles for a lot of healthcare magazines. I'm a member of the ACA and American Academy of Professional Coders. I speak for the Coding Institute, Parker Seminars, Foot Levelers, and I'm a guest speaker at many national and state association conventions nationwide. Okay, so before we get started, let's go through a little bit about the introduction to durable medical equipment, billing, coding, and documentation. So DME, or durable medical equipment, is also known as durable goods, medical supplies, and home care products, and is defined as items or appliances or devices which can withstand repeated use, are used to serve a purpose, are used to help injured or disabled people, appropriate for home use, and necessary for one or more activities of daily living. So now, the DME cycle. Let me explain a little bit about this. There's a couple of stages here regarding the DME cycle. First, when a patient is seen by a healthcare provider, and this particular healthcare provider, whether it's a medical doctor, osteopath, or chiropractor, may have the opportunity to order or prescribe a DME device. Now, for certain carriers, certain healthcare providers cannot order a DME device. So that's something you need to check with the carriers you're billing. But let me give you one example. As a chiropractor, if you're seeing a Medicare patient and you're an authorized DME supplier through Medicare, you still cannot order any braces. You still have to refer the patient out and get a medical doctor or an osteopath to create the prescription or the order. And then, as a authorized supplier of DME equipment, you can bill the patient's Medicare carrier. Now, regardless whether you're billing, well, let's say you're a cash practice. Okay, you're a cash practice. Patient comes in, has Cigna insurance. You're a cash practice. You're out of network. You can sell this patient a lumbar brace or cervical traction device. No problem. Have the patient pay you. Remember, you're out of network. Have the patient pay you, and you could submit the claim on behalf of the patient or give the patient the claim and let the patient submit it. I'll show you which codes to use for lumbar braces and traction. And then the patient sends, and then the insurance company sends a check to the patient. So there's that cycle. Who could order the brace? Who is going to fulfill the order? So that's what you need to be aware of. Now, some insurance companies may want you to be an authorized Medicare DME supplier in order to prescribe and get paid for DME. You know, there's one Blue Cross Blue Shield carrier, I think it's Blue Cross Blue Shield of Minnesota, that states in order for a provider to get paid for DME, they first have to become a Medicare DME provider. So this webinar is not on how to become a DME provider. We did that last time, so you can go back into the archives and listen to that. So there's a cycle. Somebody needs to order the brace or other DME device. Somebody needs to fulfill the order. Sometimes it's the same person. Sometimes it's two different providers. But whoever's ordering the DME is the doctor that's responsible for it and needs to create a prescription or an order or a certificate of medical necessity. Now, medical necessity, extremely important when it comes to DME. You need to understand the definition. According to CMS, the definition of medical necessity is as follows. It's a service, treatment, procedure, supply, or equipment provided by a hospital, physician, or other healthcare provider that is required to identify or treat a beneficiary's illness or injury and is determined by the contractor to be A, consistent with the patient's symptoms, diagnosis, and treatment, appropriate, B, appropriate unto the standards of medical practice, C, not solely for the convenience of the participant, provider, or hospital, and D, the most appropriate service, treatment, equipment, or supply which can be safely provided to the patient and accomplishes the desired end result in the most economical manner. That means the cheapest way to be able to get the job done is what you should be doing. The items or services being provided must be reasonable and necessary for the diagnosis. The diagnosis is one of the most important things that you need to know about and know which ones to choose when it comes to durable medical equipment. And I'm going to be giving you some information on that a little bit later. Now, before you give a patient any type of a brace, a traction device, orthotics, any DME, you have to establish a care plan, a treatment plan, a plan for care. I don't know what you want to call it, but it all begins with the patient's first visit to your office. You should be doing a history, exam, coming up with the most appropriate diagnosis, create goals for the patient, list the services that you're rendering, and come up with a schedule of care. So you need to set the table. That's why I have a picture, photo on your slide here of a table that's all set. You need to set the table before you even give the patient any type of DME. So let's start off with the history. First thing you need to do is talk to the patient. You need to write down the chief complaint. You need to go through the HPI, the history of present illness, or in chiropractic college, you may have been taught this as the OPQRST. You need to do a system review, and you also need to do a little bit of past history, family history, and social history. Now, just to give you a little insight into the most commonly billed new patient code, which is 99203. Many of you are probably familiar with that code, 99203. It's the most commonly billed new patient CPT code. So you need to have in your documentation at least one chief complaint, 2 to 9 systems need to be reviewed, 4 HPIs, or again in chiropractic college, the OPQRST, and 1 item from the past history, family history, or social history. Those are the requirements for CPT code 99203. These are according to the E&M guidelines that just about every insurance company uses. I'm going to be quoting the E&M guidelines as we go along. If anybody listening to this presentation would like to get a copy of the E&M guidelines, just send an email to Amy, that's AMY, at targetcoding.com. Amy at targetcoding.com if you'd like to get these E&M guidelines. So the E&M guidelines state that you have to do a history, which I just went through the guidelines on that for 99203. Now, if you're billing 99204, you have to go through 10 systems. You have to review 10 systems. Next, if you're doing an exam, you must do an exam on a patient that you're prescribing DME on, or even if you're referring the patient out for another provider to evaluate the patient for DME, you must do an exam. So for CPT code 99203, you have to do a detailed exam. A detailed exam consists of 12 findings, so please make sure in your documentation, in your notes on your exam, you're meeting the 12 examination finding requirement. Now, you may be thinking, well, what's an exam finding? What constitutes an exam finding? You might be a little confused with this because, you have a patient come in with lower back pain, and you say, okay, Mr. Jones, bend forward and bend backwards. So you're checking flexion and extension, and both motions are restricted and painful. That does not count as 2 findings. It's 1 finding for range of motion and orthopedic neurological tests. Now, what happens if you do range of motion and it's completely normal? Full range in all 6 planes, and there's no pain. No pain, full range. You still get credit for a finding, so it doesn't have to be positive findings. It could be normal findings, too, like height, weight, and blood pressure. 3 vital signs. If they're all normal, you still get credit for a finding. You palpate an area for tenderness. That also counts as a finding. You do range of motion in the cervical and lumbar spine. There's a couple of findings. You check for subluxation in the cervical and lumbar spine. There's another 2 findings. You check for muscle spasm, muscle weakness, atrophy. That also counts as findings in certain parts of the body. The regions of the body, according to the E&M guidelines, are 6 regions: head and neck, the trunk or the spine, and then the right upper extremity, the left upper extremity, the right lower extremity, and the left lower extremity. So 99203, you need 12 exam findings. For 99202, you need 6 exam findings. Once you get into 99204 and 99205, these are comprehensive exams, and you have to go through every bullet point within the E&M guideline chart. So those of you that want to see the E&M guidelines, you'll see the bullet points and the borders and the unshaded borders that you're required to follow. So that's the exam. The next step with the creating of the care plan before you give the patient DME is coming up with the most appropriate diagnosis. And here again, the diagnosis. The durable medical equipment must be reasonable and necessary for the diagnosis or treatment or illness or the treatment of an injury to improve function. Please be aware of that. The diagnosis is very important. Okay, now we're going to get into some specifics here. We're going to talk about billing and coding and some documentation recommendations for lumbar orthotics and lumbo-sacral orthotics. They're different. Now, these types of products can be found at discountmedicalsupplies.com. They have a wide range and a lot of choices when it comes to these types of belts. I strongly recommend you go to discountmedicalsupplies.com and take a look at all the different choices when it comes to these types of lumbar braces. So a lumbar orthotic is considered an LO. A lumbo-sacral orthotic is an LSO. And these are considered spinal orthotics. I know many doctors, especially chiropractors, when I mention the word orthotic, they automatically think that we're talking about a foot insert, and those are the only types of orthotics that are out there. No. There are lumbar orthotics, knee orthotics, shoulder orthotics, elbow and wrist orthotics. So spinal orthotics, they're typically used to immobilize certain parts of the spine to control gross movement. It's like putting a cast on a broken bone. You want to totally immobilize the area. So we're not talking about broken bones here. We're talking about severe muscle spasm and severe pain, not fractured or broken bones. And lumbar braces are one of the best ways to help reduce pain by restricting motion and help the patient get better faster. So orthotics reduce pain by restricting motion. They must support weakness and restrict motion. They should have an intimate fit. Some orthotics you must wear over your clothes. Others you can wear under your clothing. They have to have rigid panels or semi-rigid panels to be considered a payable product for most carriers. Those Velcro, elastic, stretchy type garments, they do not meet the definition of a spinal orthotic. Therefore, they're not considered payable services. If you go into Walgreens or CVS, you go into the, where they sell the ace bandages and all the different straps, braces, and collars, and you'll see they have these Velcro wide panel braces, lumbar braces, and they cost about $40. One size fits all. Little Velcro strap. That is not a orthotic. That is not considered a payable service with most insurance companies. I don't know any insurance companies that pays for that. So flexible spinal orthotics that are made primarily of non-elastic material that have a rigid posterior panel can be payable. The orthotic is designed to control gross movement of the trunk. It could also restrict motions in lateral flexion, forward flexion, or extension, and also restrict motion in the sagittal plane, axial rotation, and the transverse plane. The more motions that the brace restricts, usually the more complicated the brace is, the more comprehensive the brace is, and in turn, the more insurance companies will pay for that particular DME. If the spinal orthotic does not provide control of motion in one or more planes and does not provide intracavitary pressure, then it's not going to be payable. Your documentation must relate the patient's functional goals to the DME. There has to be a relationship. The orthotic should be part of an overall active treatment plan directed at a specific goal. When you see a patient with severe back pain and you think a spinal or lumbar brace would be effective, would hasten the healing process, that's great. That's how you show that you're trying to reach a goal. You have a specific goal in mind. And that's part of a care plan, creating goals. As I mentioned earlier, you need to do a history, exam, diagnosis. We touched on those. You also need to come up with goals for the patient, write down the clinical rationale for everything you're doing, and come up with the frequency and duration of care. Let me give you a few of the HCPCS codes. HCPCS stands for Healthcare Common Procedure Coding System. The first one here is L0625. These types of lumbar orthotics, this is an LO, not an LSO, an LO, are sold at discountmedicalsupplies.com. And this is a flexible lumbar orthotic. It provides support from L1 to L5. It produces intracavitary pressure to reduce load on the discs. It may include shoulder straps, stays. It's prefabricated. That's L0625. This is a brace that Medicare pays for, but you must be an authorized DME supplier. If you're a medical doctor and you sell one of these L0625s to a patient and you're not an authorized DME supplier, then this is just a cash, over-the-counter cash service. This is not payable by Medicare. If you want to get Medicare involved and get them to pay for these lumbar braces, then you need to become an authorized supplier of DME through Medicare, which for many people it is well worth it. Yes, it costs money. Yes, you have to fill out a lot of forms. Yes, you will have a site visit. But once you get through all of these preliminary stages, it could be a good thing to add to your practice. The next one is L0627. This is also a lumbar orthotic. It provides sagittal control with rigid anterior and posterior panels. It covers L1 to L5. It produces intracavitary pressure. It includes straps, closures, may include padding, includes fitting and adjustment. So there's more stuff going on with this brace. This lumbar brace has more items. It's more comprehensive. This one pays more. The next one is L0631. Things change now. This is a LSO. This is a lumbar sacral orthotic. Sagittal control, rigid anterior and posterior panels, and this covers T9 all the way down to the sacrococcygeal junction. So this lumbar brace or LSO brace is covering a wider area of the spine. It increases or produces intracavitary pressure to reduce load on the discs. It may include straps, padding, fitting, and adjustment. So that's L0631. Again, if you are a Medicare supplier of durable medical equipment, the fee schedule is up to about $900 for this particular lumbar brace. You don't have to bill $900. You can bill a lot less if you would like to, if you don't feel comfortable billing that much. But I don't create these fee schedules. I share them with you, and you take it from there. Next is L0637. Now just a caution, that's not the letter O. It's L0, not LO. It's L0637. It's the same with all these HCPCS codes. It's 0, not the letter O. So this one is a lumbo-sacral orthotic, sagittal and coronal control with rigid anterior and posterior panels. This also extends from T9 all the way down to the sacrococcygeal junction. It has lateral strength provided by the rigid lateral panels. So this one has more stuff going on. It's got more features. It's more comprehensive than the previous. Therefore, this one has a higher fee schedule attached to it. Now again, reminder, the diagnosis must be reasonable and necessary. The diagnosis that you choose must link properly to the procedure or the device you're using. So here's a couple of examples. For lumbar braces, here are some of the diagnosis codes that are affiliated with lumbosacral braces and lumbar braces. 722.10, herniated disc, lumbar region. Low back pain, 724.2. Sciatica, 724.3. Lumbar spinal stenosis, 724.02. Lumbosacral or sacroiliac pain, instability, 724.6. And degeneration of the lumbar or lumbosacral disc, 722.52. There are many, many, many more diagnosis codes that are associated with lumbar and lumbosacral braces. Just giving you a few just to get you started. The order of the prescription, when I was talking about the DME cycle, very important. The order of prescription must be created by the ordering provider. And make sure you get that order signed and dated. Another thing, as far as your documentation goes, make sure it leads that breadcrumb trail up to ordering the DME. Patient comes in on day one with severe back pain. There's clinical decision-making that has to be made. Patient has severe back pain. Are you going to supply them with a lumbar brace on day one? Maybe, maybe not. Maybe you'll give the patient 3, 4, 5, 6 adjustments or 6 treatments, 6 physical therapy treatments, maybe a trigger point injection. Maybe you'll do a couple of NCVs or EMGs first, and then decide if DME is appropriate. Maybe you'll do massage. Maybe you'll do traction, acupuncture before you do the DME. This is part of clinical decision making. A letter of medical necessity is another item that you should create. A letter of medical necessity helps appeal denials, helps prevent post-payment audits. So when you're billing, now we're not talking about only about Medicare here. We're talking about Aetna, Cigna, United Healthcare, Blue Cross Blue Shield, all the PI carriers, State Farm, Allstate, Geico. Contact them and get their policies on DME. Even if you're out of network, it's a good idea to do it. Some of you are participating providers with American Specialty Health Network or Optum Health. They have policies on DME. You should be aware of them. Now, members of Target Coding, we give this all to you, so I don't know how many of you listening to this presentation, if you're a member of Target Coding, we get these to you. You don't have to go searching for these. It's part of your membership. So that's one of the benefits of becoming a member of Target Coding. But here's a quick example of a medical policy on from Cigna. This is Cigna's medical policy on lumbar braces. Just page 1, so you have an idea of what it looks like. So you can go and search for it. Next, let's talk about billing, coding, and some documentation requirements for home use cervical traction. These are the types of home traction devices that you can give to the patient to take home. The patient takes these things home. Now, some of you do traction in the office, and you're satisfied with that. Patient comes in, you do the traction in your office on whatever device you feel is appropriate. You do the traction, and that's it. You might be happy with that, and you don't have to go any further. Now, some of you may want to suspend doing the traction in your office and let the patient do the traction on their own at home. It's like you could have a patient doing therapeutic exercises and stretching in your office, and after a few visits you go, you know what, Mrs. Jones, I don't think you have to do these in my office anymore. I'm going to show you how to do them at home, and let the patient do them at home. So you can do the traction in your office, or you could have the patient do the traction at home. So let's talk about home use cervical traction. The home use cervical traction is insurance reimbursable. The patient has to have some sort of musculoskeletal problem. The appropriate use of home traction should be demonstrated to the patient. So if you're going to give the patient this home traction device, explain it to them. Let them do it in your office. Watch them. Give them instructions. Go through it. You don't want a patient to go home and hurt themselves on this. Show them. Make sure they understand it. When it comes to Medicare, the patient has to sign a form stating that they understand how to use the device. You may want to use that on your regular patients too, not only with your Medicare patients. So you have to demonstrate the use of the device. The patient must have the capacity to learn from your instructions. If the patient is somewhat mentally handicapped and they don't understand how to use the device, you should not give it to them. Pneumatic traction devices are recommended for home use to alleviate pain caused by paravertebral muscle spasm. Patients should try other methods. So before you give the patient a home use traction device, they should have tried other things. Like, here's the example. Physical therapy. The patient is still having a problem. Patient was given medication. Still having a problem. It's not working. Then home use cervical traction is indicated. Now, some insurance companies, they require that the treating provider order the necessity for greater than 20 pounds of traction. Some carriers want the patient to try some other type of cervical traction device before being sent home with one. Maybe the over-the-door traction first before a home use cervical traction device is provided. Home use cervical traction equipment may not be covered unless the following: the patient fails a trial of over-the-door traction. Over-the-door traction units are covered too. Check discountmedicalsupplies.com. The patient has a TMJ disorder, which may become worse with over-the-door traction. Home use cervical traction may not be covered if the patient has some sort of distortion of the neck, so they can't use a chin strap. Patient has a 1-month rental trial period for home use traction. Now, let me share with you some of the most commonly billed HCPCS codes for home use traction. First one is E0849. So that's one choice. That's traction equipment, cervical, freestanding, pneumatic, applying traction to force other than the mandible. And then we have E0860. It's traction equipment over the door. Then we have E0856, which is cervical traction device, cervical collar with inflatable bladder. There's another one you should probably add to your list, and that's E0855. It's another type of cervical traction device. Now, again, a reminder, the home use cervical traction device must be reasonable and necessary for the diagnosis. Again, you must choose the most appropriate diagnosis codes. Here's a few examples for home use cervical traction. 721.0, cervical spondylosis without myelopathy. 722.4, degeneration of a cervical disc. 722.81, post-laminectomy syndrome in the cervical region. 723.1, neck pain. 723.4, brachial neuritis. 728.85, muscle spasm. 847.0, cervical sprain and strain. Again, these are just a few. You must learn which are the most appropriate for your patient and then match that to the insurance company guidelines. Now, when it comes to the ordering of the cervical traction, it must be created by the ordering provider. Make sure this prescription, this certificate of medical necessity, is signed and dated by the ordering healthcare provider. And make sure your documentation can show that breadcrumb trail. You don't just do DME on day one. Got to show why it's necessary, lead up to it. A letter of medical necessity for the cervical traction may be required in order to get the DME authorized. You may have an insurance company that wants to see a letter of medical necessity prior to giving it to the patient. That's actually very good. You may call to verify coverage, and the insurance company says, we don't cover home use cervical traction. Don't hang up. Say, wait a second. You just said you don't cover home use cervical traction. How about we send you a pre-authorization letter of medical necessity showing you why this would help the patient, hasten the healing process, and save money. Many insurance companies will say, all right, send it in. Send it in. Write up a good letter of medical necessity. If you're a member of Target Coding listening to this, we have letters of medical necessity for you, so contact us. Non-members, sorry, we don't give that out. But if you send in this pre-authorization or this pre-cert letter, we've been very successful in getting insurance companies that first said no to then say yes. Send in your letter of medical necessity. Tell the patient, we're not going to give you the traction device today, Mrs. Jones. We're going to send in a pre-certification to your insurance company. Let's see what they say. Let's say if they agree with us. Send it in. If the insurance company says yes, we'll pay for it, then go ahead and bill. The insurance company may say, well, thank you for your information, but we still are not paying. Then work out a payment plan with the patient. Don't just write it off. Don't just sweep it under the rug. Just because the insurance company doesn't pay for it doesn't mean you shouldn't provide it to the patient. Have a discussion with the patient. Work out a payment plan. It's okay. Let the patient pay you $25 a month until it's paid off. You want to get all the DME policies, guidelines, position statements, whatever you want to call it, from all the carriers you bill. Read them. Make sure you're following them. Here's an example. Aetna has a policy on cervical traction devices. This is just one page. You should go to the internet and go to the Aetna website and print this out and read it. If you're billing Aetna for home use cervical traction devices, please read this. It says Aetna considers pneumatic cervical traction for home use necessary. But then there are certain things that you need to do. There's 6 items. Next, for your Medicare patients, let's say you are a chiropractor and you're seeing a Medicare patient and you don't have a DME number. You don't want to deal with getting a DME number. You just want to charge the Medicare patient cash. You can do it, but then have the patient sign an ABN form. It looks like this. Your name, address, phone number across the top. What are you going to provide? It says lumbar braces, lumbo-sacral braces, cervical traction, TENS. That's fine. Reason Medicare won't pay? These are non-payable services and items by Medicare when delivered and or ordered by a doctor of chiropractic. Write down what you're going to charge and then have the patient pick an option box. You may have to bill Medicare if the patient checks option 1, you have to bill Medicare, but what are you doing there? You're billing it just for denial purposes. Explain to the patient, Mrs. Jones, Medicare doesn't cover these when I give them to you, so we can bill them, but they're not going to pay. What would you like to do? Patient might still check option 1. If they check option 2, you don't have to bill. But make sure the patient signs this and dates it. Here's a couple of other additional recommendations, and then we're going to wrap it up. No dual fees. If you're billing an insurance company $500 for a lumbar brace, and now a cash patient comes in for the same lumbar brace, you can't sell this to the patient for $50. You can't have different fees. Be careful with that. You may be able to provide a small discount, or maybe you'll have to join a discount medical plan organization like Chiro Health USA in order to drop your fees substantially, but not on your own. Also, your fees may need to be present on the patient bills or statements or super bills or receipts, and may need to be posted in the office where the patients can clearly see them. Check with your state board for these rules and regulations. And just a few closing comments. You have to check with all the carriers you bill prior to submitting claims based on the information provided in this presentation to ensure that it is compliant. Target coding does not guarantee that the information provided in this presentation will guarantee payment from any insurance company or patient.